Oklahoma has some of the worst health rankings in the nation. In a report released last week, Oklahoma was ahead of only 4 other states for poor health outcomes. One factor contributing to the low rankings was lack of access to health care, due in part to a shortage in primary care physicians in Oklahoma. To ease that shortage, some areas are depending on a different type of medical professional to help fill the gap.
Access to health care can be a challenge for many Oklahomans. According to America's Health Rankings by United Health Foundation, Oklahoma ranks 36th among all states in the number of doctors available to treat patients, with just 123 primary care physicians for every 100,000 people.
If I were to go out to try to get an appointment with a primary care provider, I'm going to have to wait. If you try to get an appointment with certain specialties, you're going to have to wait. Rheumatology, you may be waiting 6 months.
Dan McNeil, the director of the Physician Assistant Program at Oklahoma City University, says several factors contribute to the doctor shortage, including the high cost of medical school and the amount of time it takes to graduate new doctors. That's where physician assistants, who can earn their degree in just 27 months, come in.
Because the training is shorter, because the expense to the student, in other words, they graduate with less debt, they're able to use PAs and nurse practitioners in the rural area. It's easier to get them to go to the rural area.
Although they don't have a medical degree, physician assistants are the nearest thing to a doctor without actually being a doctor.
PAs are licensed in this state by the Oklahoma State Board of Medical Licensure and Supervision, the same entity that licenses physicians to practice medicine with physician supervision.
Sarah Parr, a faculty member at the OU Health Sciences Center, says PAs perform many of the same functions as a physician.
Anything from family practice, because we're trained as generalists, to work in specialties, which I've also done. You can perform procedures and suture, work in the ER, in urban and rural settings.
It's often in those rural settings that PAs are especially valuable.
I have some friends that went to Frederick and worked in the ER there in the family practice practices there, and if those docs are, stretched thin, either they can't see all the patients that need to get in, or there isn't a doc there, maybe they're using the next town, they can actually run a rural ER.
It's that sort of flexibility which made the field attractive to OCU student Madison Summers.
Coming into PA school, I thought I would be doing cardiology, and I wanted to stay up in the northeastern part of the state. But now I have started to like OBGYN, and so I think the rotations will really point me out to where I'm supposed to be, but I'm definitely staying here in the state of Oklahoma.
Legislation passed during the 2015 legislative session made it easier for physician assistants to practice in Oklahoma by easing some restrictions on the profession. For instance, PAs still have to work under the supervision of a physician, but the doctor does not have to be physically present.
As long as you're in touch with your physician via electronic or verbal communication on the phone, they don't have to be on site, and you can actually see your patients.
With the current nationwide shortage of doctors, the physician assistant field is growing. Forbes magazine recently listed it as the #1 master's degree for jobs. Susan LaVictoire is principal faculty member at Oklahoma City University.
There are always job openings for PAs. I would say that there's more demand than there is fulfillment right now.
The programs are not cheap, although financial aid is available for prospective students in the form of loans which have to be paid back after graduation.
Personally speaking, when I went to PA school, there were many students who continued to live for one more year in the manner in which they had been attending school and were able to pay off the majority of their loans in just 1 or 2 years out of school. It's doable.
The programs are also very competitive. McNeil says at OCU there were 300 applicants this year for just 36 seats.
If you look, though, at the number of students that the 3 currently operating PA programs graduate, you're looking at maybe 110 students total for a state that could probably use 3 times that many.
Current physician assistant programs in Oklahoma include the state's flagship program at the OU Health Sciences Center in Oklahoma City, another on the OU campus in Tulsa, and the newest program at Oklahoma City University.